everyone, welcome back to Urgent Care Stories. I want to thank you all so much for subscribing to the channel. It's really been cool to see how much it's grown lately, so thank you all so much for your support, and I hope that you are benefiting from these videos and enjoying the content. If you all could do me a favor, if you have specific types of cases that you're interested to learn more about, whether that be musculoskeletal things, traumas, whether it be common colds, lung issues, cardiac issues, blood clots, belly workups, headache workups, how I treat back pain, stuff like that, let me know in the comments what you guys are most interested to learn about, and I'll be happy to do some cases on those specific topics. Today's episode is a 40-year-old female that I saw a couple of years ago, and she comes in complaining of right arm pain and looking like she worked out all the time. Now, this was a woman who had a physically active job, but she had no medical history, no chronic medical issues, didn't take medications, she wasn't on birth control, pretty medically boring, to be honest with you. Out of nowhere, she noticed yesterday that her right arm just looked pumped up. It looked really swollen, like she had a really good workout. And it wasn't really like swelling in the traditional sense that you see medically. It was more just that her veins were so engorged, they were so pumped up, and she was having some pain in the arm because of that. When we look at her arm on exam, we do see, in fact, the right arm, all of her veins are bulging. It looks like she just had a big pump from working out. That arm is engorged with blood. It's very swollen in terms of the vessels, but there's no pitting edema, there's no significant swelling of a muscle or anything specifically. It's just that the blood vessels are all engorged. And if you look on the other side, not at all. It almost looks like somebody just threw up a tourniquet way up high on her arm, and all of her vessels are just pumped up. Obviously, the biggest thing that we're thinking when we see this come in is blood clot. We're thinking deep vein thrombosis. This would be a suspicion for a venous blood clot, not an arterial blood clot, because all of the veins are backing up. An arterial blood clot would look more like a pale, ischemic, cold limb. That's kind of what we would expect to see if this was an arterial issue, and somebody who's young and fit and healthy shouldn't have that. So obviously, going through our risk factors, remember we talked about Virchow's triad. It's a hypercoagulable state, venous stasis, and injury to a vessel. She didn't have any of these, to be honest with you. She had no family history of factor V Leiden, protein C or S deficiencies. She hasn't had surgery recently. She hasn't been immobilized. She's a physically active woman. I believe she worked in like a fire department or police officer or something in that trade where she had a physically demanding job. And so there really wasn't anything in the history that clued you in except for the exam and what she's telling you about the swelling and pain. What do? We get an ultrasound, right? So right upper extremity Doppler ultrasound, I stat ordered it, and we got the results back, and sure enough, she had a deep vein thrombosis, a blood clot in one of the veins in her arm. I believe it was higher up. It might have been subclavian, it might have been something in the axilla. I'm not quite sure where the clot was, but she did have a deep vein thrombosis somewhere in that arm. What do we do about this? Well, this woman she had a lot of questions for me, and it was good to have people ask you questions because sometimes it points out things that you don't know. So when we were talking, she was asking, okay, well, what should I do about this? How long is it going to take to break down? Do I need repeat testing? Do I need to see a specialist? All that sort of stuff. And then we also, she's asking, well, what are the chances this could turn into a pulmonary embolism? So obviously, my typical spiel that I'm going to give people is we're going to put you on an anticoagulant. I typically go Eliquis. That's my favorite. There have been studies done on Eliquis versus Xarelto. Those are both of our direct 10 inhibitor anticoagulants. So it blocks factor 10, which is one of the clotting cascade factors that we need to form a clot. By blocking that factor, we thin our blood. There's no drug monitoring needed. You don't have to modify your diet like you would with warfarin or Coumadin, so that's a really good choice for a lot of people. Downside is they're expensive drugs because they're newer drugs out there. Aspirin and Plavix are not enough for anticoagulation for a deep vein thrombosis. So in terms of cheap alternatives, heparin, low molecular weight heparin or Lovenox injections can be something that the patient can do. Coumadin is also another option, but again, you have to be monitoring their INR on a routine basis and trying to titrate that level between 2 and 3 for a blood clot. Xarelto has been pinned up against Eliquis, and there's been several studies that show that there's actually a less risk of repeat blood clots or transition into pulmonary embolisms with Eliquis compared to Xarelto. Now, I spoke with a couple of docs about this in the past, and they were saying that the reason for it is that Xarelto is supposed to be a 24-hour drug. So you take it once a day instead of Eliquis that you have to take twice a day. Well, the reason you have to take Eliquis twice a day is because it only peaks after about 12 hours, and then the levels in your system start to dip off. So if you're dosing it every 12 hours, you're having more of a steady state. Well, Xarelto has a similar half-life. It gets broken down around the same time that the Eliquis does, but because you're only dosing it once a day, it can have some fluctuations in that, in the blood thinning effects of it. And so when they've done studies that compare those two side to side, they've shown that Eliquis is actually a little bit better than Xarelto. But again, you're not going to be wrong by putting somebody on the Xarelto, maybe if that's an insurance issue or if they prefer taking it once a day. I mean, you got to meet your patient where they're at with those medications. We elected to put this woman on Eliquis. You start by doing 10 milligrams twice a day for the first week, and then you bump down to 5 milligrams twice a day. This was her first time having a blood clot, so we're going to go 3 months at least. We're giving her the instructions, hey, over the next month especially, the first month is the highest risk when you're in a blood clot situation. We want to be looking out for shortness of breath, stabbing chest pain, fast heart rate, trouble breathing. People describe it as a sharp stabbing type of pain in the chest when they have a pulmonary embolism. Emergency department immediately when she experiences those symptoms. 50% of people with a deep vein thrombosis do progress to have a pulmonary embolism, a blood clot in the lungs. And it's most at risk during the first month after the blood clot is formed. A lot of questions that people ask are, does the medication break down the clot forming? The answer is no, your body does that on its own. The blood clot will be broken down by your own factors that degrade that clot over time. Our goal with the blood thinner is to thin the blood so it doesn't keep adding to that clot, and so that pieces of the clot can be as small as possible. If they do happen to break off, we're not forming more and more clot and throwing it somewhere else in the body. Somebody like this, it wouldn't be a bad idea to maybe have them be evaluated by a hematologist one time, just to have some of those clotting studies, like I said, a protein C, protein S panel, factor V Leiden checks, stuff like that, just to see if she has some sort of underlying hypercoagulable state. If she does, then that would be kind of a discussion between the specialist and the patient if they want to put her on long-term anticoagulation, or if they just want to do short-term treatment for this episode. As far as I know, this woman did fine. She had no issues with this. She picked up the medication, symptoms started to resolve from there, and she was good to go. But again, remember, blood clots is something we want to try to get that ultrasound to rule it out ASAP. And obviously we want to be asking or considering, could this also be a pulmonary embolism? Those are the things that I think about. The presentation was just fascinating because usually when I see lower extremity DVTs, I see that the whole leg is very swollen and edematous. This was just that the veins were just so engorged and swollen, which was really interesting. So hope you guys enjoyed that case. I'll have another episode out later next week as well. I hope you guys enjoy. And like I said, leave a comment down below on the types of videos that you would like to see some more information about, or questions that you would like me to go over in a video upcoming. Thank you guys. Have a good one.